Hello and welcome to the tutorial on how to cast a silicone prosthetic. We will be firstly looking at what you need. So you need a silicone mould, this is a silicone Transil, a hairdryer. You will also need some ball cap plastic, this is for IPA. You need to make sure this, if you're using IPA, it's for IPA. Vaseline, this will help release your silicone prosthetic from the mould. You will also need IPA, which is to mix with your ball cap plastic, which was shown previously. You also need a sponge or a brush, either one of your choice. If you get a brush, please ensure that it's a good quality brush to prevent any brush hair getting into your mould. Then if you just simply apply put some gloves on, get ready. I'm just to begin to show you the step-by-step process. So the first step is to put a release agent on your mould. This best for prosthetics and silicone moulds is usually Vaseline. First of all, you rub it into all big chunks of it into all the cracks and detailing with a sponge or a brush, trying to ensure you cover the whole surface. Usually, if you're inexperienced, it's best to use a brush. This will help get into more of those details. The next step is to heat that Vaseline up. Now, by heating the Vaseline, it melts it. When melting the Vaseline, it allows it to trickle like water or oil into all the cracks that your brush or sponge can't get to. So simply by turning the hairdryer on and holding it fairly close to the, in this case, the Transil flat mould, you will see, as I'm showing here, rub in all the melted Vaseline into all the surface areas. If you feel there's thicker places of Vaseline, just hold that hairdryer into place and the heat will slowly melt it, creating a slip of Vaseline all over your Transil 20 mould or whatever silicone you may be using. Make sure you get all the Vaseline all around the edges as well, not just in the centre of the mould, especially where your flashing is going to be. This simply helps stop the ball cap plastic catching onto any sharp edges on the rim of the flashing. And just continue melting it away until you feel it's become a nice soft surface. In this step, you'll see me using a clean sponge. Now this clean sponge will simply get any excess thick Vaseline that has gathered in any crevices of your mould. You want to do this to ensure that your silicone and ball cap plastic will still pick up all the detail required, and that you were trying to achieve. Okay, and then just leave that to set and dry out. Okay, so you have your Transil 20 mould again, and then we're going to go in with our second layer with our first sponge we used. Again, applying thick, large chunks of Vaseline all over the mould, around the flashing and in the detailing areas. Find with a sponge to get the Vaseline on thick is by getting big chunks with your sponge and then stippling and dabbing it onto your Transil silicone mould. By dabbing it, it will also help not disturb the layer of Vaseline that you put on first. It prevents you just taking off what you've previously done. You will see, again, heating with the hairdryer, just ensuring all areas are melted, pushing around any excess Vaseline that may be needed to be moved around that are caught in crevices. As you can see, you can be doing other things at the same time if you're simply just waiting for the Vaseline to heat up, as you only want to start messing with the Vaseline once it's correctly melted. So again, just dabbing, ensuring no clumpage. Some areas may need some extra TLC with the hairdryer, mostly when there's excess Vaseline, again, in crevices. It's just the case of keep going over dabbing, being patient and ensuring you've got a nice, smooth, evenly distributed layer of melted Vaseline. Again, going in with a clean brush, trying to get any of the excess Vaseline out of the detailing areas to ensure the best casting possible. And then leave to dry. Okay, so now that your Vaseline is dry, you need to mix your IPA and ball cap plastic together. You put the ball cap plastic up to 50, and then what you want to do is times the 50 by 4 for the IPA. So you have 4 lots of IPA and 1 lot of ball cap plastic. This is down to preference, but usually most people advise, and I find the best mixing ratio for ball cap plastic, as it gives you a thick enough coating to be able to release the prosthetic evenly, but also a thin enough coating to be able to help your blending of your edges of your prosthetic once you've applied it to your model or actress or actor. Okay, so I'm just swishing it, pouring it in the mould, swishing it around and releasing any excess back into the cup to not waste any ball cap plastic or IPA. Now that's just to get an even initial coating, and then any areas that has not been reached by the swishing method, I've gone in with a clean sponge used for just the IPA and ball cap plastic and began to dab this into any areas that have been missed, which is usually the outer edges, and then again releasing any excess back into the cup. And that's your first layer. Now with that layer, it would be good to blow the layer to dry it off. IPA takes longer to evaporate. However, I do find IPA is a lot better to work with personally, rather than acetone, because acetone can go off really quick. So with IPA, you get longer to distribute the IPA and ball cap plastic over your mould before it becomes tacky. This enables you to get an even, well covered surface. Using the hairdryer on a light heat and light air, you simply just dry from a height the ball cap plastic. This helps just encourage it to dry off quickly. If you're using acetone, this is not required. So again, going in with the second layer once that first layer has dried. Using the same techniques, pouring lots of it in to the centre of the mould, swishing it round in all, making sure it gets into all the detail layers of your mould, and then using the sponge to get any areas that have been missed. Again, making sure no ball cap plastic and IPA have been wasted, so pouring the excess back into the cup. Sometimes it may take longer than other times, just be patient. Okay, so that's the second layer. Third layer, always make sure to mix your IPA and ball cap plastic before you do each layer to ensure the ball cap plastic is well mixed into your IPA. Again, pouring into the middle, trying to cover as much surface as possible. And as best as you can, moving the IPA and ball cap plastic mixed ratio around your mould, dabbing in any areas that you may have missed. Reasons for this technique is for an even coverage. This is imperative for successful silicone prosthetics, as you want, when you're releasing your prosthetic, you do not want any gaps which may cause tearing when releasing. And also it will create a quite messy casting, meaning your application could possibly not go as smoothly as anticipated. Here, just checking for any dirt, hairs, crumbs, dust, anything that could get into your mould, as ball cap plastic is very sticky, so it does tend to gather quite a lot of dust and etc. If you do, just gently, not harshly, brush it out with your finger. This will stop you pulling the other layers off. So this is the fourth layer. Same apply techniques. I usually do 4 layers for the under part of the prosthetic, for the detailing layers. I find with the mixing ratio of 4:1 of ball cap plastic and IPA, and using IPA for flat molds usually is the correct and the right amount, just the right amount of layers, as it creates a thick enough layer to release from your mold without risking the rippage or tearing it, and also thin enough to blend your prosthetic. When casting prosthetics, it can get very messy and very sticky, so I would highly recommend that you do wear suitable clothing that you do not mind getting ruined, as not only do you get messy, it's hard to get out your clothes afterwards. So yes, I would highly recommend wearing some clothes that you class as lounging or scruffy clothes. Oh, remember always checking your mould to ensure no dust particles or dirt or hair has gotten into your mould. Now beginning to blow the air to help increase the evaporation of your IPA and help with the speed process. Okay, so that is your 4 layers. For this process, this is your casting of your silicone. So all your IPA and ball cap plastic layers are dry. You need the same amount in weight, A and B, of Platzil silicone. You need, shown earlier, a skin pigment, silicone pigment, and you need 100% deadener. The reason for using 100% deadener with this particular mould is due to it being a flat mould but going over a curved surface. This will help the prosthetic adapt easier to the person's face. Just checking with any sharp object, a stick, a knife, just gently checking that your layers are thick enough all the way around your mould to ensure that you are ready and there's enough layers of ball cap plastic on your mould for casting. You will also need scales to weigh out your A and B and your deadener. You put your cup on and then wipe it out, which means you reset it to 0, so there is no added weight to the scales from your cup. Getting a mixing stick, you start to pour your A. Try to work out from the sheer thickness and size of your mould how much silicone you will need. With it being a flat mould, not as much is required. So that is A poured in and weighed. So based on your weight of your A, you cancel it out, remember the weight, and then you can begin to add the same weight with your A with the B. So you've got the same weight of A and B. This is important. If you are very far off the ratios, it can possibly, most likely, not allow your silicone to set. Mix that in a little and then continue to add your 100% of deadener. The deadener is an added product which simply softens the silicone, creating it to be soft on the skin and also flexible, enabling it to move with the face. This is particularly good in areas such as the mouth and the brow area. Once that's been added, you then add 1 to 2 drops of pigment. This is entirely on preference, but I usually keep it quite light so then you can add colour on top when painting. And also it gives it more of a translucent finish, which is what skin is like. Skin is translucent, so it's best to start off small like I did with 1 drop and then begin to add more as you feel it will need. Sometimes the pigment doesn't always come out straight away from the bottle, so as you can see then I actually only added 1 drop on top of the first drop, but it's just sometimes the pigment can be a bit temperamental and not add Okay, so then I was adding one more. As you can see, the silicone is getting slightly more pigmented, but not to the point where it is too dense and opaque. It's still got the quality of translucency. Making sure that's evenly mixed or distributed. Then from a height, you pour your silicone into the center of your mold. Then moving it around to get it into all the crevices. Reasons for pouring from a height is to help eliminate air bubbles. What this does is it stretches the silicone, and as it stretches, it pulls the air bubbles out of the silicone. So this technique helps prevent air bubbles in the finish of your prosthetic. So once all poured in, ensuring you've also poured it around your flashing, you then need to get a tool such as a spatula stick, which I've used to mix, just to simply scrape along the top evenly to get rid of excess silicone that is not needed. Silicone, it is imperative to get rid of the silicone on the edges between the prosthetic sculpt and the actual flashing itself. This is due to you do not want any silicone in that area because it will prevent you blending your edges once you have applied it onto your model. Silicone does not blend. Ball cut plastic does, but by simply scraping it along, as you can see, there is silicone in the flashing and in the centre of the mould, but not round the edging. This will help to create a perfect blending edge. Right. So the final stage of the casting is to, once your silicone has dried, is to apply your final layers of ball cap plastic. Reasons for sealing the bottom of the prosthetic with the ball cap plastic is to, like I say, seal the prosthetic, and again, it helps apply this to your model more easily. Silicone can tend to be quite squishy and sticky if not sealed with anything, so this is quite imperative when finishing your casting of your prosthetic. So using the same ratio as before, you pour it on top and trickle the excess down. Now, with this being flat now on the top, it can get a bit messier, but just simply try your best to get any excess back into your cup. Usually with this being a flat surface, you will have to often go back in with your sponge and work it a little bit more, as it's harder to lift. As you can see, it pours off this flat surface much easier than the previous curved surface which we firstly had. Again, aid the drying process with hairdryer, quickly moving it. You do not want to hold it over one area too long. This will possibly create some not very nice reaction to your silicone or your ball cap plastic. It's always nice to keep it moving over the surface. Okay, and another layer is being applied. Bear in mind the same techniques as the first one on the flat surface. Again, getting your sponge, stippling it around in any areas you didn't get. And then drying it off. So, it's always recommended to leave your prosthetic, if you can, and you're not on a tight time schedule, over 24 hours. What this does is ensures that the IPA has released properly, ensuring the release of your prosthetic is much easier than if the IPA isn't and hasn't evaporated. Now, the next step in the process, once you've left that overnight, which I did, is to release your prosthetic. Now, the way I release it, first of all, I check all my edges by simply getting a sharp tool, going around the edges, pulling up bits, only tiny bits, of the ball cap plastic to see the thickness and to make sure again that I have enough layers of ball cap plastic on my mould. Once I feel I'm satisfied with that, I then began to go round all the edge of the flashing, on the outer edge of the flashing, and release the edging of the casting from the mould. If you have Vaseline on your mould like I did, and you have enough, and enough is distributed through and over the surface, you will find this is fairly easy. I would recommend to take your time and do little bits at a time. This is to prevent any rips, as ball cap plastic and silicone can be quite temperamental. Once I have gone around the whole edging, I would then, and I have then, applied baby powder to the surface. By applying a generous amount of baby powder, it helps with the release process. If you are pulling your prosthetic back, for say, and it touches itself as you are folding it back, it can cause some stick and bondage. So if you apply baby powder, it prevents it from sticking to itself. It also helps for a smooth, clean pull. I then begin to pull the flashing away. Once I've pulled the flashing away, I then reapply underneath where I've pulled away and I have a gap, baby powder onto the surface of the prosthetic. I then slowly start to pull and keep pulling until I've pulled it off, each time ensuring that I apply more and more baby powder to the prosthetic. This again helps you release it, stops it from sticking to itself, and also when you've released it, it acts as another seal on your prosthetic to prevent anything sticking to it, such as dust particles, hair, dirt, etc. Then what you will see is the finished prosthetic from start to finish. This is your end result. As you can see, detail's been picked up. There are no rips in the flashing, in the ball cap plastic. The flashing is still intact with the prosthetic, but the ball cap plastic is thin enough to have a well blended edge when applying to your model, which is what you need to keep in mind when producing a prosthetic, a successful one. So if you apply all these techniques and follow this demonstration from start to finish, you will find that you will most likely end up with a perfect prosthetic for applying.